cannot spend less than a month that it is manageable. But most often it's between 3 months. Okay, that somebody's brain can be very settled and they can be very, they can develop the resilience, the strength to set boundaries and live a faithful and a clean life. So, to parents, they should guide their children, try to prevent them, sensitize their children that these drugs are bad. When they start it, they will end up ruining their future. They will end up thinking and talking and not doing. Because for most parents, if you see a child who was going to school, not going to school, the question mark is dropped. The child was bathing, not bathing. Question mark is dropped. The child was normally at home. Every time is going out and not having time at home. The child was most of the time you talk is respectful, is respecting you. But you talk now he respond in a very aggressive way or harsh way or rude way to you. Those are signs of drugs. Or a child who is just restless all the time, moving in and out and not concentrating in school, having failed grade when he was doing well. A child who was looking good and out of a sudden he's wearing some kind of funny clothes and piercing himself and doing stuff. All of those are signs that the child is already getting into drugs. And once you see those type of things, seek help. Don't allow it. When you allow it, that child will not just stop. And it will be causing more damage, okay, to you in the family and in the society. And the life of that child will be at high risk. Because he can just be killed for stealing to just go and get the drug. Imagine all that kind of loss. So parents should be alert, follow their children, and make sure that they are in drugs, they come for rehab. And they have started, they work together with them to see that they quit. Drugs destroy lives, destroy the future. It can ruin the family. And that's why we need to mobilize our youth to quit the drugs. We must have a very strong society and good families.
Okay, you have been treating these patients for some time now, and I discovered most of the patients here are youths. From your own perspective as a specialist, what do you think is the cause of most youth getting into drugs?
Thank you. The youth population is a very dynamic population. Any country that has the youthful population has high potentials. First, youth are very creative. Youth are energetic, and they want to have hope. They want to see possibilities. But now, imagine at the youthful age, with full potential, your life is just you go left and right, nothing is working. You try this, it doesn't work. You try that, it doesn't work. In an environment where there are no opportunities. That's why vocational training and youth employment is like a one-side coin. Okay, one coin with two faces. Mental health and job opportunities are correlated. So we do vocational training here, though for now we are offering courses that are related to nursing and so on in mental field, but youth and opportunities is what can solve drug problem. Okay, because a lot of youths get into these drugs because they lack opportunities from the start. Some men lack opportunities, or some men lack parental authorities. Some men lack opportunities. So, and the youthful age is that age of emotions where they want to fly, they want to do things and succeed. But now when they are not having coaches that can help them succeed, that breaks them down. And they will want something to manage their emotions. Sometimes they get into drugs which can help them feel, reduce their depression. And of course these drugs help reduce their depression. It's just that when they are taking at high dosages, it causes a lot of damages in their brains. So the main cause of drug for the youth is joblessness, this school boycott thing that we have gone through in the region. Some youth left school, they could not have any other thing to do and they went into drugs. Some, because of all this lockdown, this and that, they quit their own jobs they were learning. Now they are roaming around the neighborhood. The only thing is a lot of thinking. They get now into drugs. Some family separation, mother is running war, going that way, the father running this way. They are caught in the middle. So drugs have come as a result of many psychosocial problems we are going through in this region. And principally, we cannot deny that fact. It is always the the root cause of drugs. Some of them could be genetic, two factors, vulnerability. But what triggered it? Our family environmental crisis that we're going through. For many of our youth that we have here.
Thank you so much.
Thank you very much. We're happy that you came, and good luck.
Okay, God bless.
Yeah.
Okay.
All right. Let me go.